that's something people in Texas ought to know about on an individual physician basis, not have to wait 2 years to find out.
Growing concerns after the Texas Medical Board says it will take 2 years to fully implement a new healthcare law meant to protect patients. This law was sparked by KXAN's still practicing investigations. It requires stricter scrutiny over Texas doctors and increased transparency when they're disciplined. As KXAN investigator Matt Grant reports, 3 weeks after this law went into effect, it's creating confusion, not confidence, among some patient advocates.
Well, certainly a concern for patient safety.
Concern from this retired federal employee who calls Texas's rollout of a new patient safety and transparency law excessive and disappointing.
And my understanding was the intent was to have it to take effect as quickly as possible. That doesn't mean day one, but it doesn't mean, 2 years later either.
Dr. Robert Oschel spent 15 years at the U.S. Department of Health and Human Services working for the National Practitioner Data Bank, a confidential database containing doctor discipline records from across the country. Under the new state law, Texas joins 22 other states, enrolling all physicians in a nationwide round-the-clock monitoring program with the data bank called a continuous query. If a Texas doctor is disciplined by another state medical board, had their hospital privileges suspended for more than 30 days, is found liable of medical malpractice, or convicted of healthcare-related crimes, the Texas Medical Board is immediately alerted by the data bank. That information is to be made public within 10 business days. But Oschel has concerns. He points out that under federal law, any discipline records the medical board gets from the data bank must be kept confidential, so the board will have to confirm them another way before making them public, which the new state law requires. And because the monitoring program is funded through physician fees paid when they apply for or renew their license every 2 years, it will be fall 2025 before everyone is enrolled.
So the public looking up information on the board's website isn't going to know whether it's complete or it's partial or what they're dealing with. So it's going to be confusing.
Oschel questions why money to fund the mandate can't be borrowed and repaid to implement it quicker, like in California, where the medical board there says it recently borrowed $18 million from another regulatory agency to support its operations until a fee increase could be secured. The Texas Medical Board would not comment on that or Oschel's concern, saying funding for its program is provided in the law, adding, TMB will continue verifying information regarding out-of-state actions as part of the process and will handle National Practitioner Data Bank information as required by law. The Texas Medical Board said aside from hiring 5 new employees, it will cost nearly $611,000 over 2 years instead of 1 like the agency previously said to fund the continuous query subscriptions. The spokesperson said it's working with the data bank to implement and test things like electronically enrolling physicians instead of manually entering each name. Oschel said making the switch would save time, labor, and tax dollars. At the Capitol, Matt Grant, KXAN investigates.
And Democratic Representative Julie Johnson authored the bipartisan bill in response to our investigations. Now, in a statement, she says, quote, "It is of the utmost importance that the Texas Medical Board be afforded the resources needed to properly execute the measures in this legislation. My office will continue to be in contact with the Texas Medical Board to ensure HB 1998 measures are implemented in a timely and effective manner." Now, Representative Johnson is running for Congress to represent the Dallas area. We reached out to her opponents for comment as well, in addition to the bill's Senate sponsor, Bob Hall. We'll post any responses we receive online. You can see a map of all of the states that enroll their physicians in continuous query. Just look for this story by clicking on the Still Practicing tab under Investigations at KXAN.com.